Thank you, Mr. Chairman.
5 minutes.
Thank you. Thank you, Mr. Chairman. I want to thank the chairman for holding this important hearing. As a physician, I want to personally thank you, Dr. Haim and Ms. Sivich, for having the courage to come forward. While many doctors push these experimental procedures on children, you and I both know that many others have been pressured to comply or resign due to their refusal to knowingly harm children in the way that we're talking about here today. I personally know someone who was a chair of endocrinology at a major medical center who had to resign from his position because he wouldn't go along with the transgender madness that we're seeing today. Whistleblowers like you should be applauded as heroes, not the subject of federal investigations. One whistleblower who I believe we're all familiar with in Missouri, Jamie Reed, came forward about the blatant disregard for children, and she was a true believer. She was a true believer. She thought she was doing good by these so-called transgender children. She was working at the Washington University Transgender Clinic at St. Louis Children's Hospital. Washington University happens to be my alma mater, and I've been aware of this clinic and advocated for its closure for years. And that's why one of the first bills I introduced when I came to Congress was H.R. 2387, the No Harm Act, because we as doctors take an oath to do no harm. I wanted to, Ms. Is it pronounced Sivich? Sivich, yeah. Ms. Sivich, you know, it's ironic. Some of my Democrat colleagues today are talking a lot about hypothetical reforms to Medicaid and so on. But as long as we're on the subject of Medicaid, let's talk about it. I'm a physician. I've taken Medicaid patients for over 30 years. I appreciate your courage in exposing Medicaid fraud, because we know these transition medications and procedures are expensive. So I think you're doing a great service. You did a great service both to the taxpayers in Texas and, of course, the children and the family, and to all of us by exposing prohibited Medicaid coverage of transition procedures, diagnosing children with hormone deficiencies instead of gender dysphoria. I think another game they play is regarding puberty blockers, diagnosing precocious puberty when in fact these drugs were being used as chemical castration drugs to block puberty. I have to say, I treated children for 30 years in my practice, not endocrinology, but in a field where I saw lots of kids. I don't think I ever saw a kid with precocious puberty on his or her chart, and yet in some places. Tell me a little bit about what was going on. Were they were downright putting the wrong ICD-10 code in these patients' charts?
Yes, thank you for that question. Yes, Texas Children's Hospital, through two particular doctors, were intentionally misdiagnosing patients, and I saw this with my own eyes. They were, for example, labeling a male with a testosterone deficiency in order to administer testosterone. And they would do this because on the medical chart, they would put the preferred gender identity of the patient and not the biological sex. And so this makes it very difficult to detect fraud for any insurance company who gets the billing code. It's very difficult to distinguish what is actually happening.
Right. So what I have here behind me are charts, hormone therapy, and puberty blockers where the diagnosis gender dysphoria was actually the reason for treatment. So these are cases where the correct diagnosis code, the correct ICD-10 code was used in children aged 6 to 17. But if we take into account fraud where hormone deficiency or precocious puberty is used, these bar graphs would be far greater. So quite a few children are being treated inappropriately with these drugs. You know, Dr. Haim, I've been reading your story, following you. I'm running short on time, but I just want to say I cannot imagine the courage that you and your wife, and by the way, thank goodness your wife was an attorney and counseled you, because you know what would have happened? You would have made some misstatement that they would have taken out of context and you would be in prison today for, quote, lying to a federal agent. So you illustrated great courage. You did not violate HIPAA, and there are HIPAA violations all the time that are never prosecuted. They came down on you because you were standing up for kids. So God bless you, and I'm proud to have you as a fellow member of my profession.
I appreciate that. Thank you so much.
Thank you.